Oh, we're going to be talking about everything.
Welcome everyone to the Command Center at NTN GIS. I have an interesting guest today wearing a number of hats. His name is Andrew Felix. One of his primary hats, I believe, is that he is the president of the St. Lucia Diabetes and Hypertension Association. He's also a fitness instructor. Hello, Andrew.
Good morning.
How are you?
I'm good, I'm blessed. I'm smiling so much because we were having a very interesting conversation, sorry.
As we always do,
we always do.
I note you taking your mask. Somebody's probably going to be saying he's taking his mask off. That's kind of odd.
Social
there's
distancing.
way more than, exactly. So, and there's way more than 6 feet between us. And so therefore our droplets should be safe enough within our own
Correct.
space.
And I was more just showing the general public that I have got my mask and I do wear it all the time when I'm out in the general public. And there are protocols that have to be followed by all, not just persons that come in the studio or persons that are in office, but everybody has to have a mask. It's very important.
And we want to re-emphasize that the desk was also sanitized before we
Correct.
sat down.
Oh yes.
As were the mics and the chairs
oh yes.
as well.
Everything's been sanitized and wiped down, including my cell phone and my pen.
Critical, because these get used so often during the day and you touch different things as well, and the cell phone goes to your face. So really essential to get those things wiped down and out of the way quickly before we begin our program. I just wanted to run through a couple of the major issues facing us and the world, major impacts in terms of COVID-19, including health, which is why we thought to bring in diabetes, to make the connection between diabetes and COVID-19. Also the economy, education, and sports. So these are critical areas, as with the rest of our lives, that will be impacted during, well, I shouldn't say during, but certainly today and into the future. And we don't know when the future will be, when it will end. And growing up as a child, the message always was, well, plan for the future and save for the future. Well, when is the future? So is it today? Is it next week? Is it next month? Is it in 6 months? Is it in a year? So this is one of the greater unknowns. But even as we face the unknowns, what we do know is that there will be major changes in health, economy, education, and sports. Earlier in today's programming, we got a significant run-through of how it is that our education will be changing, and certainly from a common entrance perspective, the multiple choice will be the main feature of the exam, corrected by a digital means, is what our PS and CEO was saying this morning regarding education. Certainly regarding sports, a lot of sporting activities have been cancelled the world over, from summer games to the Olympic Games to cricket. There was an upcoming West Indies, I think England match coming up in June. They're saying that's looking less and less likely. So in all of the aspects of our lives, there will be changes and we will have to think outside the box. So on that note, Andrew, I can bring you in. And we were talking earlier in terms of what it is that you would normally have been doing as a busy person, self-employed for the most part. What would you normally have been doing today?
What's today, Wednesday today?
Today's Tuesday.
Today's Tuesday.
It's April the 14th.
Listen, so many days are passing by, I'm starting to lose track of the days.
But the thing is, every day looks like the other day as well.
Yeah, because when you're getting up and you're looking at the same four walls, you have to start getting creative at home. Wednesday for me would generally be, I would go to the office. Sorry, I said it again. Tuesday for me would generally be, I would go to the office, outline a few things, make sure that everything's in place, and then make sure I've got a few clients that I would do, and I would maybe go and see them, and then in the evening I would go and do a class at the Bank of St. Lucia, because it's Tuesday today.
Let me stop you. What kind of a class would that have been?
That would be a fitness class. Okay, I actually do fitness classes at Bank of St. Lucia with the staff.
So there's people?
Yeah, so there would actually be people there on a Tuesday, so that would generally be what would be my general program on a Tuesday afternoon, planning my class, putting programs together for individuals, and interacting with individuals, and doing a class, a fitness class.
Okay. So over the last 3 weeks that has changed?
Dramatically.
And you had a different plan for today. What would it
have
been?
Oh man, I said to you earlier, my plan today was a day off. So my plan today was I was going to stay at home and I was just going to just do a workout at home for myself and basically just watch movies today.
He was going to be binge watching.
I was going to be binge watching today.
That's just wrong.
Yeah, that was my day today. And then I got the call last night and said, Andrew, do you want to come over and do something on diabetes and COVID-19? I said, okay then. So here we are today.
What is diabetes?
There's so many different ways that we could describe basically what diabetes is. And the reason it's so spoke about now is because it affects your immune system. It affects your pancreas, which is an organ in your body, which produces insulin, and it's either underproducing or overproducing, so it's not functioning properly. So your immune system is affected. That's why we've got the link with COVID-19 or the coronavirus, and where we are now. Diabetes itself is a lifestyle disease. A lot of persons that are suffering from, for example, type 2 diabetes is primarily because they're living a sedentary lifestyle. They're not active enough.
Is that more people in St. Lucia? Let's bring
Round the world,
okay.
the world in general.
Okay.
If we want to talk about St. Lucia, we would say sedentary lifestyle because less people are walking now. And you know, when you're on a bus, for example, the bus will stop here and then it will stop there, then it will stop there.
Correct.
In other countries, there are bus stops.
Correct.
You would stop at a bus stop. But what I realized when someone talks about sedentary lifestyle, that word really impacts and is direct to that person in St. Lucia. Because people in St. Lucia don't want to walk.
Okay. Do you have an estimate as to numbers of people who have diabetes in St. Lucia?
Right now,
whether type 1 or type 2?
Yeah, so I haven't got a breakdown of specifics, but generally we're looking at about 20% of the population in St. Lucia have diabetes.
An age group?
And there isn't no age group, because when you look at type 1, which is previously known as juvenile diabetes, which was, you was born with it, it was for the youth, directed to youth, type 1 diabetes. But now there is a lot of individuals who are older being diagnosed with type 1 diabetes.
For the first time? For
the first time, yeah. Oh, and that's been happening, I would say, over the last 3 and 4 years.
Older would be like what? Upwards of 25?
No, upwards of, let's say 30. So in your 30s and 40s, you can be diagnosed with type 1 diabetes. So if you've been diagnosed with type 1 diabetes, the burden to you right now is that you have to take insulin shots, which is an injection, for the rest of your life. Because you chose to live a sedentary lifestyle. Now, I say 20% of the persons in St. Lucia living with diabetes. Now, if, for example, 20% of the population is living with diabetes, there are another 20% of the population wanting to get into the diabetes club.
Now, what does that mean?
That means that there are 20% people with diabetes and 20% of people who are pre-diabetic. So
simply that they've not been diagnosed.
They haven't been diagnosed. So when you go to a doctor's office, your doctor will tell you 2 things. And I've actually posted this on my status today. Your doctor will tell you, change your diet and exercise. And he told you that and you was awake. So consciously you got that information and you chose not to do anything about it. So you left the doctor's office, you're eating the same food, you're living the same sedentary lifestyle, you haven't changed anything.
What kind of food is that though?
Okay, let me give an example. This is the thing. That's such a broad question and it varies. And I'll tell you why, because I was speaking to some individuals yesterday and they said they're upset because the Prime Minister's told everyone in the country, stop drinking alcohol, no alcohol is being sold. Now, if it was me and I was the PM, you wouldn't be getting no bread, milk, cheese. And when I say milk, I'm talking all milk instead of tin milk, the sugar, the salt, processed meats. Because these are the things that contribute more to persons being overweight, obese, and having complications, health conditions. Because people are indulging so much. And then when you break it down, you're talking at things like colouring on chicken, for example. Now everyone's beating me up right now and saying colouring on chicken, right? Everyone's beating me up right now talking about colouring on chicken. But when you go to the K, the F, and the C, and you go there, they don't put colouring on their chicken. And there's a queue. I was there, I saw the queue, right? People are going crazy for the K, the F, and the C. You know the place I'm talking about.
I don't know what you mean.
Right? And everyone's going crazy there, right? And the queue there is crazy. They don't put colouring on their chicken. But people say, oh, you don't put colouring on fish. You don't put colouring on fish. So we've gone from maybe using a little browning, which was maybe brown sugar back in the day, to colouring. So we're putting more toxins in our body now than we have ever done before. That's one. We are consuming more bread now, and the flour that we use is different to what we used 20, 30 years ago. That's 2. We are consuming more carbohydrates, which is the heavier foods. We are eating bigger plates of food than we have ever done before. So when your doctor tells you change your diet and exercise, you may not know where to start. But what I say to individuals is, where do you start? You start by eating smaller portions. You don't have to look at the plate and break it down, but look at the portion sizes that you eat. Yeah, and ask yourself, is everything on your plate local?
So I guess we need to buy smaller plates, maybe?
Buy smaller plates. I would say to individuals, buy smaller plates and start with portion sizes first. That's what I would do first, seriously.
Okay.
You know.
But essentially you're saying that the link or the danger more is of being overweight.
Correct.
Which then leads to getting diabetes.
Correct.
Which then leads to a greater propensity to perhaps attracting
Yeah.
or getting coronavirus. Is that the link we're making?
Okay, so we were talking about COVID-19, and I actually made some notes, and I said that COVID-19 is changing everything that we do, from our work, our home environment, to people we interact with, and how our children even go to school. And it also has to change our lifestyle as well, which is very important. Now, your size doesn't dictate your health. It is an indicator. So I don't want anybody out there bashing me saying, oh, I'm a big person, I've always been big, my mum is big, my dad's big. It's got nothing to do with it. There are indicators. So if a lady's big and she's overweight and she's got a dark tire under her neck, okay, and she's got a lot of fat under her neck, she could be suffering from a condition called hypothyroidism, right? She could have a goiter, okay? So that's generally born from the food you eat.
What about a man? I just sort of was.
Yes, so men have that same problem as well.
Okay.
And then the other thing as well, men will suffer from erectile dysfunction, but they will look at other ways of getting an erection, like mannish water, popping blue tablets, yellow tablets, white tablets. No, those are signs that you may be pre-diabetic. Now, if you're pre-diabetic, like I've said before, then you're going to have a weakened immune system. I'm just saying it as simple as I can. I'm not trying to be technical in any way.
Yeah, we need simple.
I'm just trying to keep it as simple as possible. So if you're living a sedentary lifestyle, meaning you don't do much, if you know if you're overweight, and all those persons out there, men and women, the Grinch fairy does not come to your house. Nobody comes to your house and changes your clothes. If you go in your wardrobe and you want to put that nice sexy dress on, a nice shirt, a tight pants, and it doesn't fit, don't blame the clothes. Don't say your clothes are too small. No, your clothes are not too small. You've gained weight and now you're too big. So that is generally what people have to look at, and they don't look at it. They want to blame everything and everybody but themselves.
Just yesterday we were having this interesting discussion that once you hit 40, the weight just starts keeping, it adds up. It adds up for ladies. It's one pound from the minute you get to 30.
Oh man, yeah.
So I mean, sometimes it's actually not within our control.
You know what? Everything is in your control, you know. And I'm going to tell you why. If you've got a bucket and it's got rubbish in it, it doesn't matter how much good food you put in there, the bucket will still have rubbish in it. So what I say to individuals is, do a detox, do a cleanse, do a cooling, go back to what we used to do 20, 30, 40 years ago, yeah, and start from there. And I believe that a lot of persons listening to me right now, you know what I'm talking about. Ask yourself, when was the last time you did a detox? When was the last time you did a deworm? When was the last time you did a cooling? Call it whatever you want, it's all the same thing, because it all leads to you alkalining your body and putting your body into more of a calmer, cleaner state for you to consume healthy foods. So if you're individuals out there right now and you're saying you're eating healthy, who told you that?
Well, if I'm not having milk, then that's healthy.
Yeah, everyone says
cheese and butter. That's healthy.
Everyone says that, but then you look at how they're preparing it, and then you start breaking it down for them. So I always say, start with the basics, which is the portion sizes, cut down on maybe the dairy products, and then you start like that. But you have to start off with detoxing and cleansing first, and then you look at healthy foods first. And not everybody can go on. So let me just make something clear, because I was corrected by Perseus, who's the vice president of our youth diabetes organization, and he's actually on dialysis.
I don't want you to go too deep into that just yet. We'll take a break, and when we come back, you'll go into much deeper into that.
Yeah.
I just want to make the point also that coming up at about, it's 11:36 now, so in a few minutes we should be getting a call as well from Mrs. Romelia King. She'll be assisting the Ministry of Social Transformation with their bid to giving us information on co-parenting. So that's it'll be an external call coming in to us in studio. Mrs. Romelia King calling in to talk about co-parenting. So that'll happen in a little while, and once that happens, then of course we'll interrupt the conversation again and take the call and come back to you in studio. You're in the command center on NTN. My in-studio guest is Andrew Felix, president of the St. Lucia Diabetes and Hypertension Association. We'll be right back.
St. Lucia ka registre vermin corona ek I ka fait mouvement ek an chay vitesse tan chaque canef ka kouye pour vigilance publique la fait wolo parler en place publique qu'on bol en mai base ti boutique changer distance sociale 6 pieds hod yon a lot. I ka travay tan, si ou senti ko pa cordial, quarantine ko, pas en contact et puis l'autre, en cas où tu es exposé. C'est un écuyer, free one ou ben n'importe clinique qui est pour les pays à 10 000 à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant c'était souhait. Pays à clé en plein, ça veut dire tout bagaille fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauver vermine corona. Si nous tous servi Jidla à toutes les.
Together let us win this war. Say to shall be a soldier. Together we can beat this corona.
Welcome back. This is the Command Center, NTN. We're looking at all things related to COVID-19. My in-studio guest is Andrew Felix, and we were having a spirited discussion, Andrew. You were going to come back and talk to us about healthy eating?
Correct. I was talking about Perseus, our vice president of our youth division, and he's actually on dialysis. Hi Pert, how you doing? So his diet plan is going to be very different to the advice that I would give someone who's not on dialysis. Because obviously when you've got problems with your kidneys, you can't consume too many greens.
So let me just stop you. So everyone who has diabetes is not on dialysis?
No,
okay.
Not everybody.
Okay.
But it's one of the, see the thing is, if you have diabetes, you can end up having problems with your kidneys, you can end up having leading to amputations, problem with your eyes, and many other complications.
Right.
You can even end up having heart disease. So a lot of persons don't look at diabetes as a death sentence like they would cancer. However, it can be. And pre-COVID-19 or the coronavirus, there were amputations every day at the hospital. So I have to say that because persons need to understand that diabetes can be reversed. However, it's up to you and how you manage it through diet and exercise. So if you get up in the morning and you jump up and down for 10-15 minutes, that's fine. You know, if you're going to make sure that you're eating clean, small portion sizes, that's fine. But if you get up and you're not doing anything but watching TV, and the only exercise you do is walk into the fridge, that's not fine. You know, so I encourage people to eat clean, drink a lot of water, and just keep on moving.
But you made the point about greens, that it may not be for everyone.
Yeah, greens can't be for everyone, primarily because if you've got kidney problems, you can't consume too much potassium, you can't even drink too much coconut water or eat too much bananas because it's going to affect your kidneys. So all those persons that are on dialysis, we understand you. We're not sidelining anyone out there. We totally understand where everyone is, especially when they're suffering from diabetes, and we always end up giving you or trying our best to accommodate everyone living with diabetes, whether you've been amputated, whether you're on dialysis, whether you haven't got your medical supplies. The St. Lucia Diabetes Association is there for you. And I just wanted to say
we
that
were talking about that as well off camera, that the center had been closed.
Yes.
And then opened for minimal hours.
Correct.
Talk about that a little bit in terms
Basically,
of the hours of operations, and then when you did reopen,
yeah.
what was that?
Yeah, there was a bit of confusion because we were told that we could open because we were classified as essential services. Then we called Nemo and they said that we couldn't open. And then we were told, then they changed our status, then we could open. So there was a bit of confusion. So, and I believe there was a lot of concern because I saw these messages on Facebook and people phoning me up. So I just want to let everyone know the Diabetes Association is open between the hours of 10 and 2. And we have reduced the cost of our supplies and what we're giving out to individuals. And sometimes, in some cases, we're giving some stuff away for free. You know, as an association, we're an NGO, we do desperately still need help in terms of funds. But we are following protocols outlined by the Ministry of Health. And I have to say, I have to thank all the frontline staff. Sharon Belmar is doing a fantastic job.
Yes,
and let me tell you, right, she must be the hardest working and most tired person in St. Lucia right now. So Sharon, our heart goes out to you from the Diabetes and Hypertension Association and all your team at the Ministry of Health. You know, so the association is open. Anybody wants advice, you can come to the office. You can call us. If you want to reach out to me, you can reach out to me at the office as well. If you need any advice on where you are to where you need to be, you know, you call the office and ask for Claudine. Claudine's a long-standing member of staff. She's there right now. She's been there many years, 20 years. I believe it's her 21st year right now. So, and especially with our youth projects that we do, we've got a project right now called Life for a Child. So we do projects which are geared towards the youth. And there are a lot of youth in St. Lucia who have diabetes.
And that's island-wide?
Island-wide, island-wide. And with the help of the Ministry of Health, which I have to say as well, we actually supply products to the youth for free. So if there are youth out there who are diabetic, call our office, speak to Claudine. She's Auntie Claudine, as she's known, and she will help you get your supplies and whatever else you need.
What are these products that you talk about?
There are a lot of products which help with testing. I've got a list right here of what we actually do. So we do Lancets, which are the needles. We do True Matrix, True Balance, blood pressure kits, and Omax testing strips as well. So the machine, so you have a machine which tells you where your glucose level or your sugar level is, and then you have strips. Now, for all those who don't know about the machine and the strips that go into the machines are machine specific. That's why it's so important that we had to be open, because you cannot buy strips that we sell anywhere else. So that is one of the things I had to say, because there may well be individuals out there that haven't got that information. There may be individuals out there that don't know the importance of the Diabetes Association being open.
Okay, Andrew, I'm going to stick a pin in you right there.
Right there.
We'll come back to continue this discussion, but we have online Mrs. Romelia King, and she will tell us how she's affiliated with the Ministry of Social Transformation, and then she's going to talk to us about co-parenting and give us some facts as to how we can proceed given the COVID-19 situation. And so we'll touch base with her in a little while. In the meantime, I think we will go back to Andrew, who thinks it's perfect timing for him, but no. It's the call? Oh, great. Mrs. King, good morning. How are you?
Well, good morning, Judy. How are you? And good morning to your guest.
I think I can hear you, just barely.
Oh, you can barely hear me?
I see somebody moving hands on the other side.
Can you hear me now?
Yeah, almost. Mrs. King, hi, good morning. Hello? Can you hear us now? Is there anybody out there? I always love to say that. You're live on camera now, and I get to say it. Is there anybody out there? Okay, so we'll try to reconnect with Mrs. King in a little while. I know she's on the line, but we're having some difficulty just sort of making contact with her directly in studio. So we'll be back with her once we get the go-ahead. And so in the meantime, I think I will go back to Andrew. And he was listing some of the products that the association, the Diabetes and Hypertension Association, offers in St. Lucia. Yes, Andrew, go ahead.
Yeah. So one of the things I was saying is that the strips that we have is unique to the Diabetes and Hypertension Association. So anybody coming to the office, we normally do screening, but right now what we're doing right now is we're just selling products and giving advice.
Unfortunately, Andrew, I'm going to have to stick a pin in you again. Hope it's not hurting. But,
it's hurting.
Good morning, Mrs. King. Hello.
Good morning. Is this better?
Much better, yes, indeed.
Okay, great.
How are you?
I'm fine. How are you? How are you both?
So far, so good. I'm well, and I think Andrew, I can speak for him in this instance and say he looks well.
Okay, very good, very good.
So I was hoping that you would give us a bit of a roundup in terms of your affiliation with the Ministry of Social Transformation.
Sorry, I missed the rest of what you said.
I'm hoping that you could give us information in terms of your link with the Ministry of Social Transformation.
Okay. I'm retired from the family court as the director, but at the same time, I tend to do a lot of work with parents who are separating and divorcing, and writing custody reports for the court, as well as assisting parents with co-parenting plans so that they can be the best parents that they can for their children when they, the parents, are separating and divorcing.
Okay. So on that note, then, you want to speak with us with the advent of COVID-19 and parents and children being separated in terms of giving us some tips?
Because co-parenting in ordinary times can be stressful, can be difficult. And as we've thrown in COVID-19, we find that we're going through turbulent times, not only in our country, but globally. And it has disrupted everyone's life, literally. Mm-hmm. And it also has disrupted how parents parent their children, how co-parents manage. So it has thrown up a lot of unique challenges in managing parenting time against restrictive movements such as physical distancing, physical isolation, curfews, 24-hour shutdowns. Schools are closed and the children are at home. But since we are supposed to follow social distancing guidelines, say, for instance, even 24-hour shutdown, how is it that parents are navigating these waters? It is a challenging time for them.
Right.
Now, I'm going to give some tips that I've been given to some of our parents on how to manage this. And one of the best strategies, I think, is to try your very best, because it's not an easy and it is not the best of circumstances, but try your very best to stick to the parenting plan that you have, especially if it is one that has been handed down to you from the court. So in saying that, parents, we know that parents want the best for their children. So if we stick to the parenting plan as much as possible, court orders will have to stand unless you and the other parent mutually agree to make changes, or it is impossible to adhere to the plan. For example, we just came out of 24-hour shutdown last week and also on Good Friday. Now, if it is that the children were supposed to go from mom's house to dad's house during the 24-hour curfew, then obviously this could not have happened. This could not have occurred. So it is a matter of communicating, both parents communicating with each other, adhering to the government orders, and trying to make adjustments as much as possible. For example, if you reach a mutual agreement with your co-parent about adjusting the parenting plan, you know, especially if it is that you all can communicate. Communication is the key word here. If a parent's parenting plan is paused, specify for how long. If it is for the length of time of the 24-hour period, then what is it that's going to happen afterwards? What is going to happen when the children cannot be with the other parent? You know, work out things like regular calls, texts from the children, video calls. You can use platforms such as Skype, Zoom, WhatsApp video, and make dates with the children that, you know, today we're going to play a game and we'll play this on video, you know, and read to your children over the video and so forth. The other thing is to rely on accurate health and safety information. The most important way to protect your children and your family is to rely on accurate information about how the virus spreads and follow the health and safety protocols in both homes. Do not dismiss or minimize the seriousness of the virus. And by following the public health recommendations and government directives, you not only ensure your own, your children's, and others' safety, but you reduce the potential for parental conflict. Also, look at the restrictions and what it means to your household. You know, translate general advice such as physical distancing into behaviorally specific actions for both your households, such as play dates, no going out to dinner, no going out to, you know, to get a pizza or something, you know, no social gatherings. For adolescents, they may want to see their friends. They may want to see their boyfriends and girlfriends. And so this has to be explained to them, you know, why it cannot be done because of the public health issues. Clarify rules about hand washing, sanitation, wearing masks when going out to the shops. Now, the recommendation is for parents to leave young children at home supervised rather than take them to the shops. And calmly explain to your children what all of these things mean in an age-appropriate way. And remember, your two households are connected because the children are going from one household to the next. So, you know, ensure that whatever you do in your household will not endanger members of another household. For instance, having groups of people come in who who are not of your household, for example, because we want to keep the children safe. We want the best for the children, and we do know that the children can transmit the virus from one household to the next if we're not very careful. Okay? Plan and problem solve your way through uncertainty. Like I said at the very beginning, communication with each other as parents is a must. And at this particular juncture of what we're experiencing, communication, I cannot stress that enough. So brainstorm solutions when you have emerging issues and choose the best course of action for the situation. And communicate all the time about significant changes and circumstances in your home so that your children aren't relaying information to the other parent, but the two of you are relaying information to each other. If you or your child becomes sick with the virus, what are the plans that you have in place? It is essential that we discuss those plans. What are we going to do if it is that I find myself sick and the children are with me? How am I going to get the children, or how are the children going to get to the other parent, etc. If that can happen. It may not be able to happen because the children may themselves be transmitting the virus. Okay? Give each other the benefit of the doubt when anxiety are high and this can go a long way in keeping tensions and conflict in check. Okay? If it is that you have parental conflict arising and you already have the assistance of your attorney, your social worker, or your mediator, give them a call and see how it is that you can, significantly reduce any form of parental conflict. The other thing is you must take care of yourself. Sometimes we forget about that. That while we may be focusing on protecting ourselves and our families' physical health, we must not forget to take care of our own mental health. Seek services from mental health professionals, and other people who can support you or give you strategies, to seek some form of assistance. The other thing is be a good parent. We all want to be good parents, and our definition of good parent changes from parent to parent. And by being a good parent, we look at the warmth and patience that we need to engage in speaking with our children. Because warmth and patience may run low as pressures mount. But children especially need their parents to be emotionally understanding and supportive in these very, very difficult times and very frightening times, because they will be asking questions, they'll be wanting definitive answers, which none of us can produce because the virus is ever-changing. Strategies to deal with the virus is quite fluid. It keeps changing from day to day, from moment to moment. And so we as adults are already confused. Can you imagine our children? So we must try to give them that anchor that they need. So the other thing we can do is to monitor and regulate our own emotional state and avoid overexposing our children to our fears. So fears and anxieties. They themselves, the children, are dealing with losses and disappointments related to all different types of things, cancellation of schools, and the inability to meet their friends, the inability to have play dates, the inability to even interact with other children in their own community. So they're dealing with lots of losses and disappointments. The other thing we can do for our children is to limit the amount of time that they watch the news, because if we turn on the TV at any moment during the day, on the news channels, all we get is COVID-19, and we are overwhelmed by the information that we're getting, much less our children. So we can limit that for them, so it can limit their own anxieties. The children do experience fear of the virus and uncertainty about the future, because we too are uncertain about the future. Check in with the children about what they're hearing and what they're feeling. Just ask them very simple questions. You heard this. What do you think? What do you feel? What is happening to you? What's going on? These are very simple questions we can ask them. And we can validate their feelings by saying, you know, I too feel like this, or it is normal for you to feel like this because this is an abnormal situation that we're all dealing with. You know, while helping them to put their losses, their fears and boredom into some form of perspective. You know, help your children to employ, you know, different types of coping skills and foster resilience. Now, they're going to look to their adult caregivers for that. Mm-hmm. So we need to teach them different types of coping skills.
Let's just take a break, Mrs. King, and we'll come right back to you so that you can then wrap up for us.
Of course.
You're listening to Mrs. Romelia King, who's on the line, giving us some very valuable co-parenting skills at this time in our development as people and dealing with the COVID-19 situation. We'll be right back after this break.
Hi, I'm Jim Joseph, President of the Bosiju Community Group. We believe St. Lucia can win the war against the coronavirus, and here's how. Every community in St. Lucia must mobilize, coordinate, monitor and support residents the way we would before, during and after a natural disaster. Identify volunteers in your community, assign them roles and deploy them. Ensure your elderly and vulnerable understand all protocols. Help relatives, shield them from unnecessary contact with others. Identify those recently unemployed and vulnerable neighbors living alone. Put systems in place to filter updates from official sources throughout your community. Promote the hotline number 311. If it takes a village to raise a child, then all of us can come together to defend the village against the coronavirus. Let's do it.
Together let us win this war. Said we shall be a soldier. Together we can beat this corona.
This is the command center at NTN, and we have Mrs. Romelia King on the line giving us very interesting points there to deal with co-parenting and children who have to go to different homes during this period of COVID-19. Mrs. King, perhaps you can get on with your information and you can then give us more information that you have and then lead into a wrap-up as well.
Okay. Well, in fact, I'm almost done actually, Judy.
Okay.
Yes, like I said, you know, assist the children to develop reasonable structure to daily life. You know, structure for all of us is what helps us to cope. You know, what we do at certain times, we wake up at this time, we have breakfast at this time, we start doing schoolwork at this time, because I know children have been given some routine schoolwork for them to do. Mm-hmm. When they finish that at this time, what is it that they're going to do? You know, include routines such as chores, playtime, safe socializing online, you know, allow them to do that, but in a very safe space. Some outdoor time in the garden, some screen time with the other parent. All of that, I think, will assist in, you know, the co-parenting that some parents have to do. Finally, you know, I'd like to say we must remember that this is temporary, but how temporary is temporary, we do not know. But during the pandemic, there are things that we must do and sacrifices we must all make for our own, our children and others' safety. And at the end of the day, all parents want to be the best parents that they can be. And that is one of the things I'd like parents to remember. Just continue to do your best as a parent for your children, love your children, you know, tell them this too shall pass. These are some of the things that we hear around. Allow them to talk to you. If you're not with your child at the moment, the parent who has the children in their care, you know, make some arrangements that you're able to speak to the children during the day. You're able to see them on video. They're able to see you on video, so that connection, that attachment is not broken. Remember that these are adjustments, and these adjustments are temporary. Life will return to normal, but it will be a different type of normal. This is what we have been hearing.
Right.
And this is an opportunity for us to also model for our children healthy coping skills. Show them how resourceful they can be by modeling how resourceful you can be. Show them how resilient that they can be, so that by you modeling your own resiliency. And like I said, all parents want to be the best parent they can be, and here is an opportunity for us to do so. But also, communication with the other parent is a must.
Critical.
We must try to do that. We must try to remain calm, because this is a difficult time for everyone, and we know that everyone is doing what is in the best interest for their children.
Did you have any specific advice for children, Mrs. King? Because I note that your advice is very parent-pointed.
Yes, because basically I was talking about how parents can co-parent.
Yes.
There are many tools out there that that we could use for children. I am not a child psychologist by any stretch of the imagination, and I'm sure, no doubt, one of my colleagues can talk about this a bit more.
Right.
But engaging children in talking, young children, get them to do coloring, talk with your children, always be there for them, try to reassure them, that you're going to be there, that, it's basically, we just have to keep a lot of reassurance going on, and help children to express and to label their feelings and label their thoughts, so that you as the parent can validate those thoughts and feelings for them.
I think that's a good way to wrap up. Thank you very much, Mrs. King, for taking the time out to call in to give the information. It's funny, you sort of, based on where you are in your life situation, you sort of are blindsided and don't see another perspective. So this has certainly broadened the discussion in terms of how we are dealing with COVID-19 in a more complete way, of parents, of co-parents, of children, of specific areas and communities, whether you have diabetes or not, service clubs and so on. So we want to thank you for making the time to call in to share with us today. Thanks again.
No problem. Thank you very much, Judy, and stay safe.
Thank you. You as well. Thanks.
Okay.
In studio, we have Andrew Felix with us, but just on the line there, Mrs. Romelia King, giving very interesting pointed comments for parents and how you can co-parent in different households. A child now not necessarily being able to move between parents because of a 24-hour lockdown situation, for example, even a 10-hour curfew situation, for example, where they can't go out to get the pizza, they can't go out with their friends, they can't go out within the community setting with their other friends as well. And that communication really is key to that process of keeping yourself from going insane and your child as well from going insane. Talking to the other parent and talking to the children as well to reduce the stress levels. Always critical, especially at a time like this. So Andrew, let's throw back to you in studio, and we were really trying to establish healthy eating, healthy living, and that's all part of the healthy living as well.
Definitely.
Looking after the children in different households as well.
I like there's some key points that I got from that, which I just want to
read.
Really, yeah. So keep taking the words out of my mouth. Reduce anxiety. I think that's key, especially if you've got children in your household. Always reassure the children that are in the household that everything's going to be okay. And there is going to be a new normal. Mrs. King mentioned that, and there is definitely going to be a new normal. If you look at all the Massey and all other government organizations right now, they're trying to upgrade where they are to where they need to be. It's like jumping from 1980 to 2020 all in the space of a couple of months.
Exactly.
It's going to be hard.
Well, our schools are starting on the 20th of April with distance learning.
It's going to be hard.
Virtual learning.
Yeah.
So that in itself is a challenge that we have to now relate to in a completely different way.
Listen, the implementation process is going to be really hard, but everybody needs to get on board because there has to be a change, and there's going to be a change. Whether you want to change or not,
it's happening.
It has to happen. And one of the things I keep saying is you should not have allowed the COVID-19 virus to jumpstart where you need to be. It shouldn't have been like that.
We just leave that there.
It shouldn't have been like that. For your health, specifically your health. And I go back to it again. When you leave your doctor's office and your doctor tells you change your diet and exercise, and you choose not to do it, he's already given you the information. You're supposed to jumpstart. You shouldn't be jumpstarting now. You should have done it already. And then the other thing that Mrs. King mentioned is as well, we need to plan and problem solve issues. And what I like to say with that is focus on solutions, not problems. Because when you're in a household with individuals, everyone starts getting on your nerves. Everyone's on a short fuse. And even if you're in good company, you may still find that you're isolated. So for me, for example, and a couple of the others, like Tyson Brown over in Viewford, I'll give you a shout. We Push Ducks, Socafit, Clinton, I'll give you a shout as well. And myself, what we've done is we've got online programs, so you can sign up to online programs. You can work out at home with minimal equipment, sometimes zero equipment, just a bottle of water, a towel, you know. And what we do is we do, like, for example, I do simulation. So if you haven't got a step, get a wheel, get a tire, stand on it, get a breeze block, stand on it, use it. Use the steps in your house. You know, you don't need equipment to get healthy. You don't need equipment to work out. You know, you can use what you have.
But it comes down to self-discipline, though.
Exactly.
If you don't have the intrinsic, and again, because we had this karate, the president of the Karate Association, the Federation, Senior Federation here, and he was talking about intrinsic motivation.
Yeah.
Without that intrinsic motivation, you're dead in the water.
Listen, the motivation right now should be very simple. Make the adjustment or die. I don't think there should be anything in the middle. It should be adjust or die. You know, if you go back to the 80s, everybody was talking about HIV and AIDS. That was a big thing. Now, I just want to touch on some stats quickly. If you pick up your phone right now and you go to Google and you ask Google how many people worldwide have HIV and AIDS, you're going to get a number of 38 million. Now, the reason right now everybody's talking about pre-existing conditions and they talk about diabetes, because when you ask that same question, how many people worldwide have diabetes, it's 415 million. So it's 11 times as much as HIV and AIDS. That is why persons living with diabetes, there is such a concern for those individuals living with diabetes. We're not sidelining anybody. If you've got diabetes, if you think you have diabetes, yeah, you need to get tested, you need to get checked. It's very important. You know, so I have to emphasize on that. And I have to put that on a lot of the teachers as well, because we need the teachers' help as well. Before, maybe not so much now, because they need to identify conditions. Because if you've got a young pupil in the classroom and that person's acting up or falling asleep, it could be because they're suffering from diabetes. It could be because they didn't have breakfast, they didn't have a meal last night. There are issues. So now teachers have to become psychologists and analyze all of these behaviors, which is very, very important. And I keep saying,
it's harder now because
yes,
it's harder now.
It's harder now. So the parents now have to become keepers now.
No, parents are supposed to parent.
Yeah, parents are supposed to parent, but now they're supposed to be the keeper of everything now. Because when your child when you leave and go to work, someone else is looking after your child, a school teacher, you know, maybe it's a neighbor, maybe it's a grandparent.
Chances are right now you're in home.
Exactly.
Looking after the child.
Going back to Mrs. King and what she was saying, co-parenting is very important. So right now, it's not just about co-parenting, it's about being a parent, being that parent. And right now, I just want to harp on that as well a lot, because you have a child, you have a choice right now. You have a child. You have a choice right now. You can either be looking after your children or your children can be looking after you. And right now, as a parent, you want to be looking after your children. You know, you want to be the keeper. You want to be the breadwinner. So if you're sick, you need to put a plan in place in terms of who's going to be looking after your child. And we don't want parents to be sick. We already know there's a massive burden on our healthcare system right now. We want to reduce amputations. We want to reduce persons living with diabetes. We want to reduce children and adults who are obese. We want to reduce the burden on our healthcare system. Right now, the healthcare system have reduced all operations, all non-clinical stuff.
You made that point earlier, that in terms of amputations, you were saying that there would have been at least one amputation a day.
Every day.
Under normal circumstances.
Every day, yeah.
So what's happening now that they've
Listen,
stopped?
right now, it's funny because I've said this before. There are individuals right now and they've got bipolar, ignorant, irresponsible behavior. They're not looking after or taking the advice from the doctor. And I go back to the human beings. Take advice that your doctors are giving you. So if your doctor's told you you need to look after your foot, check your feet on a regular basis, and you haven't done that, you've gone from having a toe infection to now you've got a foot infection. You went to the doctor said you might have to get your toe amputated. You made a choice, I don't want to get my toe amputated. You go back in 6 weeks, now you have to get your foot amputated. So what happens now is people have to take more care of their self. Simple. You can't put it any other way. You know, everybody who's suffering from diabetes has to be able to check their feet. Because
they're told how to do that.
Yeah, you know what? We did screening last year in Viewfront, and we were surprised at police officers, Andrad Felix, got to give you a shout, King, and all those other guys out there, the tailoring service, making masks, I'm giving you a shout. You know, we were screening police officers, and some of the police officers that have done 24 to 48 hour service, they've been on shift for 2 days. Some of them had stones in between their toes, One officer had a thumbtack in his toe. He said he doesn't know how long that's been there. It might have been a thumbtack in your foot for maybe 2 days.
And that's a true story?
That's a true story. I didn't make that up.
How recent is that?
That was last year. That was last year. So there are officers right now, because of the inadequate footwear they're wearing, because they don't know what is the correct footwear. So we advise you on that. That's the importance of the Diabetes and Hypertension Association.
But I mean, I'm sorry. This comes back to the simple task of washing hands.
Correct.
This is nothing new.
Nothing new.
So checking your own feet.
Listen.
That you live with every day.
Yeah.
That's nothing new either.
Yeah, but some people can't reach their feet, Judy, because they're overweight. They haven't stretched, they're not fit.
No, let's use the police officer as a specific example.
Okay.
Who I want to say is fitter than most.
Correct.
And
I would agree to you. That's where they should be.
I want to say that...
We have to make that assumption.
Yeah.
Yes.
So I want to say that this police officer could reach his toes.
Correct.
And check his toes.
Yeah.
Wash your hands.
Correct.
Check your toes.
Yeah. Basics.
Nobody should have to tell you this.
No. Basics. But it's going back to COVID-19 and creating a new norm. Right now, everybody is saying the biggest pre-existing condition that people need to be aware of is persons living with diabetes. Mm. So all those persons that went to the doctor's office and were not taking that advice, you need to take that advice now more than ever. And if COVID-19 has been your push to start, you better go all in and be all in right now.
I think you want to take this last few, I think we have about a minute remaining to just sort of do a really key critical points of a wrap up for us.
Okay then, so there are risk factors which predispose individuals of developing diabetes, such as being overweight, sedentary lifestyle, smoking, and unhealthy eating habits. So my final words would be, change the food you eat, or the food you eat is going to change you.
It can't get any more poignant than that.
Can't get any easier than that.
Okay. This is the Command Center on NTN. Our in-studio guest, Andrew Felix, again giving us some, if you can't change the food you eat, tell me again.
Change the food you eat, or the food you eat is going to change you.
Right,
yeah.
Okay. And we want to have positive change. So if it is that you want to eat fruit, a fruit-based diet, if it is that you want to eat a greens-based diet, because again, he's saying to us here that based on your body type, that there are certain things you can and cannot eat as well.
Correct.
So as much as you're trying to remain healthy, but still you want to ensure that what you're eating is good for you. So don't just go a crash fruit or a crash greens, but that you need to be careful with what it is you're choosing to eat as an all-healthy diet.
Portion
but
sizes
I think
first.
yes, exactly.
Yeah.
So now we're going to go and throw all of our big plates away right away, and then buy smaller plates to start with.
Sauces.
Or use the sauces. Use the sauces. Don't pile them up high, but make them sort of palatable anyway. Don't use the browning.
Correct.
Don't
avoid putting toxins in your body.
And avoid the milk, the cheese, the butter, did you say as well?
Yeah, the sugars, the salt. Don't go overboard with all the unhealthy stuff because you're at home now. Because maybe when you're at work, you're going to drink more water. When you're at home, you're going to drink less water. So keep drinking a lot of water and try and focus on less snacks, more healthy. Simple as that.
Okay. I think that's it for our program for today. The Command Center, Jazz NTN, thanks for joining us. Our in-studio guest, Andrew Felix, the president of the St. Lucia Hypertension and Diabetes Association, and he is always available. You want to just give us your contact details?
See, you can call the office. It's 452-7693. 452-7693.
And you can always walk in as well to the association. It's open from 10 to 2.
10 to 2.
Monday to Friday.
Monday to Friday.
Even today during the...
Even
not
today.
just today, but
today
in terms
we're open
of the,
today, Monday to Friday.
Over the 10-hour curfew period as well.
Correct.
Okay, great. Thanks for joining us.